Tonight, I'm going to talk about a subject very important to me, one of my best friends that we went to school together, have this syndrome. A syndrome many people don't talk about, dumping syndrome. When you think about dumping syndrome, think about two things, the stomach and the small intestine. What is dumping syndrome? Dumping syndrome is a medical condition in which your stomach empties its content into your small intestine more rapidly than it should. Also, it's called rapid gastric empty. Because your small intestine receives uncomfortably large amount of poorly digested food. And when that happens, it can cause symptoms of nausea, bloating, abdominal cramps, and diarrhea. And it can also cause sudden blood sugar change. That's what you have to think about. I'm not going to go, since the time is not enough for us, to go to what happened in dumping syndrome. The only thing I want you to know, some people experience another set of symptoms a few hours later. This happened because of blood sugar change. If your small intestine receives a concentrated serving of sugar content, it may set off alarm in your digestive system. Your small intestine may signal your pancreas to release extra insulin to regulate your blood sugar. So, that will cause your blood sugar to drop sharply and give you a reactive hypoglycemia. This drop can cause you faint, shakiness, and heart palpitation. They estimate about 20 to 50% of people who have stomach surgery develop some symptom of dumping syndrome. And it most common in people who have surgery that will bypass large portions of the stomach, such as gastrectomy or gastric bypass surgery. Occasionally, it can also occur with certain gastrointestinal disease. Someone asked me, is dumping syndrome serious? Under normal conditions, dumping syndrome is not dangerous or life-threatening. But a severe case can cause rapid weight loss and nutritional deficiencies. You could have persistent, unmanaged diarrhea, who can cause dehydration, and those complications, they can be managed or prevented with self-care. Dumping syndrome is not usually permanent. Dumping syndrome have two phases. You may experience one or both phases. For example, early dumping syndrome occurs within 10 to 30 minutes after you are finished to eat. That was what my friend was experiencing. The moment he finished to eat, he has nausea, vomiting, abdominal pain and cramp, and he also has diarrhea. Also have a distended abdomen, the feeling bloated, dizzy, spell, and her heart beat fast, heart rate acceleration. When late dumping syndrome begins to show, the sign is about 2 to 3 hours after you have finished eating. You may experience weakness, fatigue, jitter or shakiness, rapid irregular beat, cold sweat, face flushing, brain fog, hunger. That's the second phase of the dumping syndrome. Let's go to surgical cause. People who have gastrectomy mean that they have surgery to remove part of or all of the stomach. People who have bariatric surgery, for example, for weight loss, they have gastric bypass. Pyloroplasty, people who have operation on the pyloric valve at the bottom of your stomach. Esophagectomy, surgery to remove part or all of the esophagus. Vagotomy, surgery to cut the vagus nerve in the stomach to reduce stomach acid. When people, they have too much acid in their stomach, sometimes the surgeon will go and do that type of surgery. There is another also called Nissen fundoplication, surgery to sew the top of the stomach around the esophagus. For disease-related cause of dumping syndrome, you have people, especially people with diabetic, people with cyclic vomiting syndrome. Cyclic vomiting syndrome is when people experience severe nausea, vomiting, and have exhaustion that can last few hours or few days. Although the symptom won't occur each day, but the syndrome itself can last a lifetime. People with autonomic dysfunction. Autonomic dysfunction means that people with orthostatic hypotension due to autonomic dysfunction as a nervous system issue. Those people, they cause drop in the blood pressure when they stand. This type of orthostatic hypotension happens with many common chronic conditions, especially people with type 2 diabetic, Parkinson's disease. And this problem usually treated with medication or non-medical method and approach. People will experience exotic pancreatic insufficiency. For example, people who have pancreatitis, they have high triglycerides, cystic fibrosis, or other conditions that affected the pancreas, who cause the exocrine pancreatic insufficiency. Those people don't have enough pancreatic digestive enzyme to break down food and absorb nutrients. You see, that's where natural medicine comes from, digestive enzyme. It can lead to malnutrition, and most of the time, those people need pancreatic enzyme replacement therapy will help them with this type of problem. Duodenal ulcer. For example, people with peptic ulcer disease. Especially, you remember when I did a program on that, too much acid can cause you peptic ulcer disease or gastric disease. So, especially people with peptic ulcer disease, they have open sore or ulcer in the stomach or first part of the small intestine. So, many cases of peptic ulcer disease develop because of bacterial infection. Either way, the positive lining of the digestive system. People who frequently take pain reliever are more likely to develop ulcer, especially people who take a lot of medication. You see, I talk about probiotics, lining of the digestive, because when you have too much bacteria infection, eat away the protective lining of the digestive system, that can cause you to have peptic ulcer disease. You have sore and ulcer in the stomach or in first part of the small intestine. There is also syndrome. I don't see too many people talk about it. Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is a very rare condition that causes tumor called carcinoma to grow in your pancreas or intestine. What happens is the carcinoma, the tumor called carcinoma, release the hormone gastrin, which triggers your stomach to produce gastric acid. You know, gastric acid is no good. So too much stomach acid leads to ulcer. and other complications. Some carcinoma are also cancerous. So I urge you, if you have that kind of problem, please go see your doctor. Sometimes people have something called functional dysphagia. Functional dysphagia is a kind of chronic indigestion. For example, those people have a stomach pain, they feel bloating, they feel their stomach big after they finish to eat. And most of the time, there is no cause this type of symptom. They can find it. You go to the doctor don't find it, you say you're okay. But there are many treatment options. There is no one solution that works for everyone. So please go see your doctor on that question. Another thing so might cause disease related to dumping syndrome, cannabis hyperemesis syndrome. Cannabis hyperemesis syndrome, I may have to say, affected people who use cannabis, for example, marijuana. So the cannabis hyperemesis syndrome can cause frequent severe nausea and vomiting. Those people have high risk. At least if you are using marijuana, I cannot tell you don't use marijuana. Please, if you use cannabis, at least use it once a week to decrease the risk of having cannabis hyperemesis syndrome. The only way to cure cannabis hyperemesis syndrome is to stop using cannabis. Cannabis hyperemesis syndrome, as I tell you, it caused by people who use marijuana for long term. And those people usually experience nausea, vomiting, dehydration, abdominal pain. And when I used to work at the ER, I see a lot of patients who come for this type of problem. They have many tests to diagnose dumping syndrome. You have to go to your healthcare provider who knows what he's doing, who can do those tests for you. For example, all glucose tolerance tests. That's a test. What they did, they measure your blood sugar before and after you drink a glucose solutions. He also measure your hematocrit, red blood cell count. A rise in hematocrit after you drink the glucose indicate a large amount of fluid moving from your bloodstream into your intestine. A drop in blood sugar 1 to 3 hours afterward indicate late dumping syndrome. So all glucose tolerance tests, especially in natural medicine, we did that a lot. Hydrogen breath test. Hydrogen breath test, we did a lot of this stuff with the test. Because hydrogen blood test is a test who measure the hydrogen level in your breath after you drink a glucose solution. A positive breath test for hydrogen showed that the glucose wasn't well absorbed in your small intestine. This suggests that your small intestine was too overloaded. Again, they can do another test also, upper endoscopy. GI doctor will do it for you. What they do, they examine inside of your esophagus, stomach, and duodenum with an endoscope to see where is the possible cause of your symptoms. They also do upper GI series. This imaging test allows your doctor or the healthcare provider to watch a fluid contrast solution travel through your esophagus, stomach, and upper small intestine, the duodenum. After you drink the solution, a technician takes a series of video X-ray called fluoroscopy. The series will show how fast the solution travels. They also do another test called gastric empty test. This test measures how fast food moves to your stomach by adding a trace amount of radioactive material to your meal. Your healthcare provider will be able to watch your meal progress to your stomach on a special type of scanner. Now, how they manage and treat your dumping syndrome? How you get rid of your dumping syndrome? Most people can successfully manage dumping syndrome with a diuretic change. When severe symptoms don't respond to diet, medications may be an option. But medication can have side effects. It is not the ideal for long-term use. Rarely, when dumping syndrome results from surgery, when all other treatments have failed, your healthcare provider might suggest another surgery to fix the problem. Now, that's where natural medicine comes from. When you have dumping syndrome, you must have general guideline on your diet to reduce symptoms. For example, if I have dumping syndrome, I will eat smaller meals more frequently. For example, aim for 6 meals instead of 3. Eat slowly and chew throughout. When you eat, don't take the food and then swallow it. Slowly, chew it throughout and then eat it. Most important, avoid simple sugar, carbohydrate, and milk products. If you have dumping syndrome, common sense. Avoid sugar, carbohydrate, milk products. Because this will prevent rapid blood sugar shift. Remember what I tell you. You have dumping syndrome because the food go fast, right? Don't give you fast. So your stomach, the food go to your mouth, to the stomach, and it go fast, rapidly into your small intestine. And that cause you have dumping syndrome. And usually, one of my friends, whenever he eat, if he doesn't go to sleep, he will crash his car. If he's driving, he'll go crash his car into a tree. Because the moment he eats, he falls asleep. Because you must avoid simple sugar, carbohydrate, and milk products. Because that will prevent blood sugar shift. Complex carbohydrates, you have whole grain, are better. And I will come to that later. Eat more protein and healthy fat to replace carbohydrate in your diet. Because fat slows down digestion and provide a steady form of energy. Some people think when they eat carbohydrate, they get more energy. No. Replace the carbohydrate. Use fat, slow down. Remember, fat slow down digestion and provide steady form of energy. Eat more dietary fiber to add bulk to your meal and slow down its transition time, right? Because fiber slow down sugar absorption in your digestive system. You see, that's where natural medicine comes from. I love natural medicine. You see, that's where it comes from. Plus, if you want to go to eat, especially people with Down syndrome, the moment they finish to eat, you see, they go to sleep. Lie down on your back for 30 minutes after eating. If you lie down on your back, you know what will happen? That will slow down the gastric empty and help maintain blood pressure during digestion because your blood pressure will stay stable. Remember, that will cause a shift, and that causes the blood pressure go down, give you hypoglycemia and hypotension, and that creates problem for you. Don't drink fluid within 30 minutes before or after eating. Every of my program, I tell people, do not drink fluid within 30 minutes before or after you eating. Anybody. Not only those people who have dumping syndrome. Because fluid encourages motility. So if you're doing food, right? So transient time, right? Don't drink fluid within 30 minutes before or after eating. There is certain medications can help modify the symptom of early and late dumping syndrome. For example, go to your doctor, he will tell you that. I'm more into natural, but I can tell you there is a medication called octreotide acetate, and what it does is slow down the gastric empty and small intestine transit time. It also suppresses insulin. This medication, I think your doctor, they usually use it. We usually use it as an injection. And so that's your doctor should be able to explain you that. There's another medication called cowbase. This medication usually regulates your blood sugar by slowing the rate at which your body absorbs carbohydrate. They say that it has been shown to reduce hypoglycemic and late dumping syndrome. I think we used to use this medication a lot in private practice. But believe it or not, there is a lot of people with dumping syndrome. Where I work, I see a lot of people with dumping syndrome. Surgery. There is a patient who asked me that. Is surgery recommended for dumping syndrome? Surgery is rarely recommended for dumping syndrome. But if surgery was optimal, depending on your doctor, what they decide to do. When nothing helps and dumping syndrome is severely affecting your quality of life, you might choose to undergo reconstructive surgery. That's dependent on your doctor. What he will do, he will reconstruct or modify any part of your stomach, that isn't functioning well. He will reverse or convert gastric bypass operation to a less severe alternative. Please, if someone who has those symptoms, if you have nausea, vomiting, diarrhea, abdominal pain, cramp, distended abdomen, feeling bloated, dizziness, spell, your heart rate acceleration, beat fast, and you feel fatigue, weakness, shakiness, jitteriness, cold sweat, face flushing, brain fog, hunger after you finish to eat, I encourage you, please go to see your doctor so he will know what to do to help you. The best part for me, someone asked me that. That's the reason I do this program. What food should I eat and not eat while living with dumping syndrome? Yes, diet can help modify or prevent dumping syndrome. Particularly if you have gastric surgery. The doctor, you have operation, they take your stomach, or whatever gastric surgery you have. What food you should eat? That patient asked me, what food should he eat? What should she not eat? Okay. Best food to eat. You need protein. You need fat. You need complex carbohydrate. You need fibers, especially soluble fiber. I'm going to explain to you. Protein, for example, I talk a lot about protein. Anybody who watch my program, they know what type of food you have for protein. For example, eggs, meat, poultry, fish, nuts, butter, beans, legumes. Those are protein. Fat, butter, mayonnaise, salad, dressing, avocado. Remember, avocado has the higher pH to protect your immune system. Only fish, not butters. Complex carbohydrates, you have unsweetened whole grain, cereal, oatmeal, bread, rice, pasta. Soluble fibers, you have peas, beans, apple, orange, carrot, broccoli, Brussels sprout. Those are the food better for you if you have dumping syndrome. What you should avoid: sweet, for example, candy, packaged breakfast cereal, sugar drink, dessert, milk, cream, yogurt, cheese. If they bother you, don't eat them. They're no good. You have to avoid them if you have dumping syndrome. If you don't want the dumping syndrome, stay forever. If you are at risk for dumping syndrome, for example, white bread products, crackers, chips, fruit juice, sweetener, calorie-rich drink, for example, shake, nutritional shake, liquid nutritional supplement. All those, avoid them. Eat protein, Eat eggs, milk, poultry, fish, nuts, beans, legumes, vegetable, peas, beans, orange, carrot, broccoli, buxel. I'll repeat them again for you. Grain cereal. Those are the best food to eat. Fibers. Because fiber is very important. Why fiber is important? Because fiber slows down sugar absorption in your digestive system. Remember what happened to you is because when you eat, your stomach empty too rapidly the food you eat into your small intestine. And those are large amount of undigested food to flood your small intestine. And when that happens, you will experience nausea, abdominal cramp, and blood sugar reaction change, drop. And create you more problem than happen. Remember one thing before I go. Dumping syndrome is the most common post-gastrectomy syndrome that affect people recovering from surgery. There is a good chance you may experience some symptoms immediately after your procedure. They say, fortunately, most cases of dumping syndrome are mild and go away on their own in a few weeks. And in the meantime, you can usually manage dumping syndrome by adjusting your diet. If you're one of the person who have this problem, please visit your doctor. Because most people can successfully manage dumping syndrome with dietary change. Doctors treat dumping syndrome by recommended change to how and what you eat. Remember what Hippocrates said, you are what you eat. Let food be your medicine and let medicine be your food. Many people with dumping syndrome have mild symptoms that improve over time with simple change in eating and diet. The first step in treating dumping syndrome is changing how and what you eat. If you know anybody who have this problem, encourage them to have an appointment with their doctors, because dumping syndrome, you can find relief. Another time, another day, I will bring you a new program again. Good night. Bye-bye.